you have Part A, Part B, so Part A hospital, Part B outpatient, Part C is Medicare Advantage, Part D is drug coverage. Part C and D are also plans. So Part C Advantage, or the Advantage system was created by the federal government, but Part C only comes from private insurance. Part D drug coverage was created under Bush Jr. in 2006. You can only get Part D prescription plans through private insurance. So a lot of people come in and they're turning 65 and they're in good health and they say, why would I buy prescription coverage? I don't take any prescriptions. Well, someday you might. So for those people, we recommend a $12.60 per month prescription plan. It's the least expensive prescription plan out there. And if you need different or better prescription coverage down the road, you can change to a different prescription plan between October 15th and December 7th and get something different for the next year. Each year you wait, it's a $4.28 per month penalty. So if you turn 65 and buy a Medicare supplement and never buy a Part D drug plan, you'll never pay a penalty. This is if you've gone years later and then bought a Part D plan. And so if you're 70 and you went 5 years without drug coverage, and all of a sudden you've got a $5,000 a month drug, so you buy drug insurance. For those 5 years, you pay about $21 a month extra for the remainder of your life, as long as you have drug coverage. So you can't buy a Part D plan from the government. Your A and B can be covered by the government, but Part D always comes from private insurance. If you don't buy Part D until after age 65, so say you're 69 and you have no drug coverage between age 59 or 65 and 69, you pay a lifelong penalty if you ever went back and bought a drug plan. And we're actually going to get into the numbers a little bit later. I had somebody come in yesterday who's almost 69 and just now retiring. And so it says, if staying on an employer plan past 65, verify that prescription coverage is creditable. That means it has to be as good or better than Medicare Part D. And the insurance company for every group health plan is required to mail out every year. The employer is required to send a notice every year if the Part D coverage is creditable. And so if you've had Part D coverage that's creditable from 65 to whatever later point you retire, you supply that proof and then you don't pay penalty. So how can you get drug coverage? You can actually have, not listed here, you can get a drug plan if all you have is Medicare Part A. And I had a client with just Medicare Part A. He was paying $40 a month for a drug plan. Excuse me, he had A and B and a drug plan. And I said, we can get you a Medicare Advantage plan for $0 instead of $40, and now you get health care too. So just having Medicare A and B and a drug plan is not a good idea. But the normal thing is you get, like that earlier slide on the left, there were 3 pieces, 3 ID cards. So the normal thing is if you get a Medicare supplement, or if you get Medicare plus a Medicare supplement plus a prescription plan. So that's number 2 here. Or you can have Medicare Advantage plans with Part D built in. There are Medicare Advantage plans that don't have Part D drug coverage built in, but so if you are the VA, or if you served in the armed forces and you have VA drug benefits, you might want a Medicare Advantage plan without drug coverage. But what you're not able to do is pick a Medicare Advantage plan and a different drug plan. That's not allowed. You can only have one or the other.